Hey, Dr. George here. One of the most common questions that I get from people who are interested in our weight loss program is, the differences between sort of medical weight loss pathways and bariatric surgery. And what I tell them is that there's really a lot of overlap. If you're really serious about losing weight and keeping it off, it boils down to things like changing your lifestyle, behavioral modification, cleaning up your diet, and finding a long-term sustainable way to keep your diet under control. And that's true for whether you're kind of trying to do it without surgery or with surgery. The bariatric surgeries that we offer are nothing more than powerful tools. Okay, so it's like if you take your car to the mechanic and they're trying to figure out how to get your car fixed for whatever reason, they're not going to use every single tool in the toolbox. They're going to kind of use a tool that is the right fit for what they need to do. And that's how we think as weight loss specialists and as bariatric surgeons. So a bariatric surgery is a great tool, it's a powerful tool, but it's a tool. And so you still have to do all of the things that are important in order to get your life changed so that you can lose your weight and maintain it long term.